Welcome to my channel, RX Sam 2020. Today we discuss a drug named Etoricoxib. About Etoricoxib is a selective cyclooxygenase COX-2 inhibitor. It exhibits nonsteroidal NSAID, anti-inflammatory, analgesic, and antipyretic activities without inhibiting gastric prostaglandin synthesis or affecting platelet function when given in therapeutic doses. It is well absorbed when administered orally. Currently, it is approved in more than 80 countries worldwide but not in the US, where the Food and Drug Administration, FDA, has required additional safety and efficacy data for Etoricoxib before it will issue approval. Medical use. Etoricoxib is indicated for the treatment of rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, primary dysmenorrhea, chronic low back pain, acute pain, and gout. Approved indications differ by country. In the UK and Germany, it is also used for the short-term treatment of moderate pain after dental surgery of adults. Combination. Etoricoxib plus thiacolchicoside is a combination of two medicines, Etoricoxib and thiacolchicoside, which relieves pain and relaxes the muscles. Etoricoxib is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking the release of certain chemical messengers that cause pain and inflammation, redness and swelling. Thiacolchicoside is a muscle relaxant. It works on the centers in the brain and spinal cord to relieve muscle stiffness or spasm and to improve pain and movement of muscles. What is rheumatoid arthritis, RA? Is a long-term autoimmune disorder that primarily affects joints. It typically results in warm, swollen, and painful joints. Pain and stiffness often worsen following rest. Most commonly, the wrist and hands are involved, with the same joints typically involved on both sides of the body. The disease may also affect other parts of the body, including skin, eyes, lungs, heart, nerves, and blood. This may result in a low red blood cell count, inflammation around the lungs, and inflammation around the heart. Fever and low energy may also be present. Often, symptoms come on gradually over weeks to months. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It occurs when the protective cartilage that cushions the ends of the bones wears down over time. Although osteoarthritis can damage any joint, the disorder most commonly affects joints in your hands, knees, hips, and spine. Osteoarthritis symptoms can usually be managed, although the damage to joints can't be reversed. Staying active, maintaining a healthy weight, and receiving certain treatments might slow the progression of the disease and help improve pain and joint function. Ankylosing spondylitis, AS, is a type of arthritis characterized by long-term inflammation of the joints of the spine, typically where the spine joins the pelvis. Occasionally, areas affected may include other joints such as the shoulders or hips. Eye and bowel problems may occur as well as back pain. Joint mobility in the affected areas generally worsens over time. Primary dysmenorrhea is the cramping pain that comes before or during a period. This pain is caused by natural chemicals called prostaglandins that are made in the lining of the uterus. Prostaglandins cause the muscles and blood vessels of the uterus to contract. Gout is a form of inflammatory arthritis characterized by recurrent attacks of a red, tender, hot, and swollen joint, caused by the deposition of monosodium urate monohydrate crystals. Pain typically comes on rapidly, reaching maximal intensity in less than 12 hours. The joint at the base of the big toe is affected in about half of the cases. It may also result in tophi, kidney stones, or kidney damage. Dosage. Children less than 16 years, contraindicated. Creatinine clearance, CrCl, less than 30 milliliters per minute, contraindicated. Administration may be taken with or without food. If the patient has hepatic impairment, mild, child pug score 5 to 6, maximum 60 mg once daily. Moderate, child pug score 7 to 9, maximum 30 mg once daily. Severe, child pug score greater than or equal to 10, contraindicated. For all medical use of Etoricoxib, use the lowest effective dose and follow the shortest possible duration of treatment. Oral. Osteoarthritis. Adult, 30 mg once daily, may increase to 60 mg once daily as necessary. Oral. Rheumatoid arthritis. Adult, 60 mg once daily, may increase to 90 mg once daily as necessary. Once the patient is clinically stable, may reduce the dose to 60 mg once daily. Oral. Ankylosing spondylitis and rheumatoid arthritis. Adult, 60 mg once daily, may increase to 90 mg once daily as necessary. Once the patient is clinically stable, may reduce the dose to 60 mg once daily. Oral. Primary dysmenorrhea. Adult, for the treatment of acute pain, 120 mg once daily. Maximum treatment duration, 8 days. Doses should only be given during the acute symptomatic period. Oral. Acute gouty arthritis. Adult, 120 mg once daily. Max treatment duration, 8 days. Oral. Acute pain. Adult, for the treatment of postoperative dental surgery pain, 90 mg once daily. Maximum treatment duration, 3 days. Contraindications. Hypersensitivity. Creatinine clearance, CrCl, less than 30 milliliters per minute. Inflammatory bowel disease. Severe congestive heart failure. Active peptic ulceration. Cerebrovascular disease. Children less than 16 years. Lactation. Special precautions. Severe renal disease. Pre-existing edema. Hypertension or cardiac failure. Coagulation defects. Withdraw treatment if gastrointestinal, GI, lesions develop. Caution when administered to dehydrated patients. Pregnancy, Etoricoxib should not be used from 20 weeks of pregnancy onwards because it may harm the fetus. Elderly, no dosage adjustment is necessary for older patients. Regular blood pressure monitoring is advisable. Side effects. Asthenia, fatigue, dizziness, lower extremity edema, hypertension, flu-like disease, GI upset. Like all other NSAIDs, the COX-2 inhibitors have their share of adverse effects. Fixed drug eruption and generalized erythema, acute generalized xanthematous pustulosis, AGP, erythema multiforme-like eruption, and drug-induced pretibial erythema are some serious side effects reported, besides the usual innocuous ones. Drug interactions. Warfarin, rifampicin, methotrexate, ACE inhibitors, lithium. Brand names that are mostly prescribed by doctors. Arcoxia, Ezact, Ritos, Etolin. Frequently asked questions. How long Etoricoxib can be taken? Etoricoxib should be used only for the acute painful period. The recommended dose is 120 mg once a day, which should only be used for the acute painful period, limited to a maximum of 8 days of treatment. The recommended dose is 90 mg once daily, limited to a maximum of 3 days of treatment. Can I take Etoricoxib with alcohol? Do not drink alcohol during treatment with Etoricoxib. Etoricoxib and alcohol consumption increase the risk of bleeding from the stomach and intestine. What painkillers can you take with Etoricoxib? You can also take opioid-type painkillers such as codeine, cocodamol, tramadol, or morphine in combination with Etoricoxib. However, don't take anti-inflammatory painkillers, NSAIDs, like aspirin, ibuprofen, or naproxen with Etoricoxib, as this increases the risk of getting side effects on the gut. Mechanism of action. Etoricoxib works by blocking the effect of a natural chemical called cyclooxygenase 2 (COX-2) enzyme. This enzyme helps to make other chemicals, called prostaglandins, in the body. Some prostaglandins are produced at sites of injury or damage and cause pain and inflammation. Thanks for watching. Please subscribe and like this video.